pharmacist, and I have the pleasure of presenting to you today on regulatory risks, their status, their changes, and strategic considerations. As you think about the term risk, that usually evokes thoughts about personal risk, such as with drug safety. In today's discussion, we're going to be talking about regulatory risks being enterprise threats, if you will. So that may include patient safety risks for a new drug in development, but it may also include a number of other things that are process-related in working through regulatory bodies as one seeks registration of a new biologic or drug. And as such, the important elements that we're going to be talking about relate to anticipating risk and creating contingency plans so that one can effectively manage these situations. So the agenda for today is to talk about first, as you'll see on the agenda here, the general review and approval process to give us a frame in which to work. And then second, to talk about some of the emerging issues and new trends as it relates to enterprise risks or threats in regulatory affairs. Third, to talk about what those changes may mean in terms of an impact on the drug development climate. Impact for companies, for practitioners who may use those future products, for regulators as they think about the number of changes that may need to occur in their best policies, procedures, and practices. And then to close, a discussion about, given a changing environment, what are some of the best and worst biologic and drug development practices that we should consider? It is a lot like the weather, and as you see in the map in the lower left of this agenda, that's a depiction of a weather pattern. You see under there the term Doppler 314. No, I do know the difference between the Doppler effect and the spelling here. The Doppler effect is something quite different, and it dictates that silly ideas become more plausible as they come more rapidly at you. And as a result, one needs to be careful that new changes do not lead to either overcorrection or, I'd like to redo this slide. As you see before you, the agenda first is a discussion of the general frame of how drugs and biologics are brought to market, their review and approval especially emphasized. And then second, what occurs over time